you describe a excisional breast biopsy?
So an excisional breast biopsy is essentially a procedure that is used as a diagnostic tool. So there are patients that have benign breast lesions that need removal. So we only remove the area of interest. So that's the excisional biopsy, meaning we just take the area of interest out of the breast. The way that we do it here is using something called a magnetic seed. You could also do it without any localization technique if it's a palpable mass. So let's say you have a 5 centimeter mass that I can palpate. You don't need anything to be localizing the area of interest before surgery. But in most cases, if you have something that is found under mammogram or under ultrasound or under MRI that needs surgery, we place something called a magnetic seed, which is a little clip that is placed next to the area of interest that helps us localize the area during surgery. So this procedure is done in the operating room. The patient's asleep, not awake. It's under anesthesia. Usually patients have a small incision. We do something called hidden scar, meaning it goes around the areola to have better cosmetic outcome, and long-term the healing process and the scar is very minimal. And then we find the area of interest and we excise it. An excisional biopsy is not a cancer surgery. It is for benign disease or for patients who you want to rule out cancer. So it is, in those cases, a diagnostic tool that helps us take out more tissue so that pathology can look at it under the microscope and rule out a cancer. So the two, I guess, the most common indications for an excisional biopsy are a benign lesion that needs to be removed or a lesion that is high risk to rule out cancer. It is an outpatient surgery. It usually takes from 20 minutes to 45 minutes. The recovery is about 7 to 10 days. You go home the same day, and the patients do fairly well from it.